retirement. There we go. And so the Part D then is something you want to sign up for right away with the other parts of your Medicare to make sure that you don't miss out on the coverage of Part D for prescription drugs when you finally need it. Now, with Medicare, there are really two roads that you can go down. There's the road on the left-hand side of this graphic, and then there's the road on the right-hand side. The traditional road, which we call original Medicare, is on the left-hand side. So you sign up for Part A, again, that's hospitalizations. You sign up for Part B, which again are your regular doctor visits and so on. Then you can add Part D, which again is optional, but I strongly encourage you, if you're going down this road, to sign up for Part D in addition to the other parts so that you have that prescription drug coverage when you need it. And we'll talk about the premium costs associated with Part D. Now with A, B, and D on the left-hand side there, you still have a number of things that you might have to pay for out of pocket. We call these gaps or holes in Medicare. And so there are deductibles, there are co-payments and co-insurance and all that kind of stuff. And so the bottom part of this road is where you can purchase a Medigap policy from a private insurance company. Medigap, which is also known as a supplemental policy, really allows all of those holes within your prescription or within your Medicare coverage to be filled by the supplemental policy. And actually, if you have all four of these parts, A, B, D, and a supplemental policy, and I know you have good coverage at the medical college, but this, the combination of all that gives you some of the best health care that you may have had your entire life under the Medicare system, where you would not necessarily pay all that much out of pocket if you have all four parts of those on the left-hand side. Now, let's talk about Medicare Advantage. That's the road on the right-hand side. And the same thing there is you still have Medicare Part A, you still have Medicare Part B, but then instead of getting a separate Part D policy and a supplemental policy, you can get a Medicare Advantage policy that combines Part D. So you get a prescription drug benefit with most Medicare Advantage policies, but then there's also some supplemental coverage as well. So you might say, well, that kind of sounds like the same thing. So is there a difference there? The road on the right-hand side with Medicare Advantage is cheaper as far as premiums go. But even though it's cheaper on the premium side, you're going to get nickel and dimed a little bit more in your coverage. So that means while you might be going to your doctor or doing some other routine care type things with the doctor in the hospital or whichever, you might be paying some more money out of pocket with those bills, but still you have pretty complete coverage. But when you go to the doctor, you might be paying $25 here or there, or $10 or something to that effect. Now, the experience that I have with a lot of people on Medicare Advantage is, yes, they're paying out of pocket things, maybe in the $500 to $700 range per year, depending on how often you're going to the doctor. So plan for some out-of-pocket costs, but we'll talk in a moment about the premium savings that you have under Medicare Advantage versus original Medicare. So those are the two roads that you can go down, and we'll get into that a little bit more as well. Now, let's talk about enrollment, because this is one of the most important parts of this presentation, and a part where if this isn't done properly, you become one of those 1 out of 4 people in retirement that wishes they could do something over. Now, one of the most important things about Medicare enrollment is if you're going to work past the age of 65, which I know many people at the medical college do, then there is an important piece of information about enrollment. So you can work past the age of 65, not enroll in Medicare if you are covered by an employer group plan that covers 20 or more employees. Otherwise, if you don't, then you have to enroll in Medicare. So, number one, if you're retired by the age of 65, and then you're about to turn age 65, then you have to enroll in Medicare. If you're working past the age of 65 and you have coverage yet through the medical college, then you can be exempt from enrolling in Medicare. But then as you're close to when your employment terminates, then you want to sign up for Medicare. So there's 3 enrollment periods that are key with Medicare. And we're going to cover each one of those 3. But here's the situation, though, is if you do not enroll in Medicare on time, number one, you're going to be subject to late enrollment penalties. We're not going to cover how those penalties are calculated. You don't want to know what those penalties are because, frankly, it's not just an upfront penalty that you're paying. The penalty, if you are subject to that penalty with late enrollment, that continues built into your premium for Medicare, not just for the first month, not just for the first year. Your penalty, if you're subject to it, lasts the rest of your life. You do not want to be subject to that penalty. It will cost you a lot of money, especially if you have a long life for that to be carried out. Now, the second thing is if you don't sign up on time, your healthcare expenses may not be covered by insurance. If you're signed up on time, there are no pre-existing conditions with Medicare. They have to accept you, even if you're purchasing a Part D policy from a private insurance company or a Medicare Advantage or a supplemental policy. There are no pre-existing conditions involved here. They have to accept you, and they also have to charge you the same rates as everybody else if you're signing up on time and signing up properly. If you're not, you might lose some of that guaranteed coverage. So you need to be very careful there as well. And it's not just the coverage, it's that private insurance companies might be limiting your options in those policies under Medicare that you'd be purchasing through them as well. You need to sign up for Medicare on time because the consequences are very significant. So, let's say you are receiving Social Security already when you turn 65. Medicare Parts A and Parts B are automatic. If you don't want, so you might still be working, but if you're drawing Social Security, because Medicare and Social Security are really enrolled through the Social Security Administration, they will automatically then withdrawal premium for these Medicare units right out of your Social Security paycheck. You don't even have to do anything. You're automatically put into A and B if you are already on Social Security when you turn 65. Coverage starts the month that you turn 65. So your coverage for a couple of days, couple of weeks might be starting when you're 64 because it started the month that you turn 65. Part C and D, so Medicare Advantage, which is Part C, and the prescription drug coverage, D, are not automatic. The responsibility is yours to sign up for those through a private insurance company and proactively enroll in them. Now, some people ask, why is Medicare so strict about signing up for Medicare? Well, Medicare is not any different than a regular insurance company. And the way a regular insurance company works is they need a pool of people that are insured and that are paying premium as part of being in that pool, because essentially some of the people in the pool are going to be a cost or an expense to the insurance company. Others in the pool that maybe aren't filing very many claims are the ones who are helping to pay the costs for the people that are going to the doctor quite a bit. So frankly, Medicare is like any other insurance company where they need more people in the pool in order to help to cover expenses as well. So they take this very, very seriously. The consequences are significant. Now, if you are not receiving Social Security when you turn 65, then you are subject to one of these three enrollment periods: the initial enrollment, the special enrollment, and the general enrollment. We're going to cover those in order. So the initial enrollment period is if you're signing up right at 65. For 3 months prior to your birthday, where you turn 65, you are able to enroll in Medicare. Again, for 3 months prior to your 65th birthday. If you sign up prior to your 65th birthday or up to the month before you turn 65, then your coverage starts right as you turn 65. If you sign up the month that you turn 65, then your coverage starts next month. And you do have 3 months after you turn 65 in order to sign up. The however there is guaranteed coverage, no pre-existing conditions. The catch is, though, if you sign up in the 3 months after you turn 65, then your coverage gets delayed. In all likelihood, that's not a big deal. However, things happen in life, things happen in this world, and if you come down with some sort of illness or health condition during this small period of time, you are not covered by Medicare, and that could be disastrous. That's why I encourage you, if you're signing up by your 65th birthday, sign up in the 3 months prior to that 65th birthday, not only for Part A and Part B, but if you're going with Medicare Advantage Part C, a prescription drug benefit Part D, if you just sign up for all of that stuff in the 3 months prior to your 65th birthday, you're going to be fine. Okay. So who signs up for Part A during the initial enrollment period, the 3 months prior to your 65th birthday? Again, it depends on if you're working or not. If you're not and you're going on Medicare, then you always, I mean, really, even if you're working, you might as well sign up for Part A regardless, because Part A is free to you. There's no premium cost to Part A. That's your hospitalizations. And so working or not working, you might as well enroll in Part A anyway. However, there's one exception to this, and that is if you are participating in an employer plan, like at the medical college, and you're under the high deductible health plan where you can participate in an HSA, a health savings account. You cannot participate in an HSA with tax deductible contributions and be on Part A at the same time. If you enroll in Part A, you can still have your HSA, you just cannot contribute to it. So something to keep in mind there. If you're not participating in an HSA, even if you're working past the age of 65, sign up for Medicare Part A. There really isn't any reason not to. Signing up for Part B. So people who are not covered by a comprehensive employer-sponsored plan that covers 20 or more employees. So this doesn't apply at the medical college, but if you're with an employer that has 10 employees, then regardless of your coverage there, you need to sign up for Medicare at age 65. But other people that have to sign up for Part B, if you're not working, you have to sign up for Part B by age 65. If you're self-employed, if your employer has less than 20 employees, if you're on COBRA. So a lot of you might know, if you retired at 64, under federal law, you can still participate in your employer plan for up to 18 months. The catch is that you have to pay for the whole thing under COBRA. But if you do that and you're under the medical college's coverage, for that year and you plan on going until 65 and a half to complete the 18-month period of time, you're in trouble. Because even if you're on COBRA, you still have to sign up for Medicare at 65. Don't make that mistake. Others that have this, if you're receiving retiree health benefits from an employer and you're retired, then you also need to sign up for Medicare. Even though you're under that health plan, if you're not employed there anymore, you have to sign up for Medicare. And then finally, if you're employed by a company whose health plan is less comprehensive than Medicare. So you might be in a company that has more than 20 employees, but if they don't meet the designation of being a comprehensive plan, then you still have to go on Medicare. That's not an issue with the medical college, so we're not going to go any further with that. Also, Part D, I mentioned to you that with Part D, even though if you're not on prescription drugs, sign up for Part D anyway. It only costs $40 a month, generally in premium. And so it's important for you to go on Part D even before you need it, because heaven forbid you get diagnosed with cancer. And some of the prescription drugs that you're going to need in order to fight that cancer might be very expensive. And you're going to have to cover out of pocket a number of months before you can then enroll in Part D prescription drug coverage. So best to get it up front while you're signing up for Medicare Part A and Part B, then you're going to be covered. Okay, now, for those of you that are working past the age of 65, Terry, did I see a hand up?
Yes, we had a question. Just to clarify for everyone, MCW does not have a high deductible health plan, and therefore what goes along with that is a health savings account, or HSA. So we don't have to worry about those parameters at this point. But someone did ask for Part A sign up at 65, no HSA contributions. What about flexible spending accounts, or FSAs?
That's fine. That's fine. That does not conflict with Part A then. That's a good question. Okay, we good? Okay. Okay, now the special enrollment period is something that's important for a lot of you that are working past the age of 65 and you're maintaining your coverage through the medical college. Now, first of all, you don't have to stay on the medical college health plan. You can choose to go on Medicare. And so that option is yours. But for those of you that really choose to stay on the medical college plan, then the special enrollment period is for you. This is pretty simple. Let's say you're working past the age of 65, and then your retirement date is when you turn 68. The idea is the same though, is sign up and enroll for Medicare in the months prior to your separation from employment. So if you're planning on retiring when you turn 68, and let's say that's July 15th, go in and sign up for Medicare in May already. Sign up before to be activated at that point. Now you'll see on my slide here that you do have an 8-month period of time starting the month that your group coverage ends. So you do still have time, and this is a little bit unique about the special enrollment period. I don't like to mess around with this stuff since the consequences are so significant. I still encourage people, if you know your retirement date, go ahead and sign up in the couple of months prior to your termination from the medical college as you retire, so that everything is in place before your coverage ends, and then you're good to go. But you do have an 8-month buffer in there in order to sign up as well. Now, Part D is a little bit different. You don't have 8 months after your coverage ends. You have 63 days after your coverage ends. And so that's important to be mindful of that. And the thing is if you're not enrolled in Medicare Part A and B, you really can't sign up for Part D, in which case, if you're going to go on Medicare Part D, you really have to get A and B taken care of and then sign up for Part D within 63 days after your coverage at the medical college ends. So that's the special enrollment period. The best time to enroll in Medicare to avoid any penalties is sign up during the initial period, which is by age 65, or the special enrollment period, which is your termination of employment after the age of 65. To avoid gaps in coverage, sign up before your current coverage ends, and then you're good to go. Now, if you're not good to go, then that means you fell into the general enrollment period, and this is not where you want to be. Because if you're in the general enrollment period, that means that you have not signed up for Medicare on time. That means that you are going to be subject to penalties that will last the rest of your life. And you also might be subject to some coverage that might not be available to you any longer. On top of that, if you fall into this general enrollment period, there's going to be a significant period of time where you don't even have coverage, even after you realize the mistake that was made. So let's say in May, this month, you've decided that you made a mistake and you didn't sign up for Medicare on time. So you go and enroll in Medicare, but actually you're going to be told that you can't sign up until January, February, or March of next year. On top of that, once you sign up in the first quarter of next year, your coverage doesn't actually begin until July 1st. So you're going from May right now all the way past a year next year into July before your coverage even starts. And you're basically praying that there would not be any significant health events that come your way in that period of time. That's the general enrollment period. That's the one that you want to stay out of. So here's a summary of the enrollment periods, the initial, the special, and the general. And I think we covered that pretty thoroughly. So let's move on from there. How do you actually sign up for Medicare Parts A and B? Actually, go to www.ssa.gov. And all of you, I'm sure, are technology savvy, and going out there, getting enrolled with a user ID and a password. You've got to jump through those hoops. We've all done that in other areas. And then you can sign up for Medicare out there. You can also sign up for Social Security out there. And maybe those are two different events. But I find the website to be pretty user friendly. I'm pleased with the navigation within the website. I've helped clients to sign up, and it's been pretty straightforward. If that is uncomfortable, you can call that Social Security number, 800-772-1213, and that works as well. And for the first time in about 2 years, my understanding is that the Social Security offices are open again, where they were shut down due to the pandemic. I would not just show up at a Social Security office. Best that you contact them ahead of time and schedule an appointment, and you can do it that way. So it's one of those 3 ways to actually sign up for Medicare. Now, how do you sign up for Medicare Part D? Again, it depends on which road you're headed. Is it the road on the left side, Original Medicare, or is it the road on the right side, which is Medicare Advantage? With Original Medicare, you'd be signing up for A and B, but then Part D, you would be signing up through a private health insurance company. But the best way to shop for that is to go to Medicare.gov. Because these Part D plans are regulated by the government and they have to follow government and Medicare stipulations to even offer a Part D program, all of these are generally available on Medicare.gov, where you can shop for your plan. Now, how are you shopping? Basically, what you're doing is, if you currently are on prescription drugs, you'd be entering those into the system, and it will guide you to probably what is the best plan for you. And this is where I want to mention too, is don't make the mistake of signing up for a Part D prescription drug plan and assume that that is going to be the last one that you're ever going to need the rest of your life. These plans are changing all the time. So the plan you sign up for might change. The competition might change. Shop your Part D every year, because these plans do change a little bit, Plus your life changes a little bit. You might have new medications that you're on. And so then the enrollment period, October through December each year, that's when you want to reshop your plan and make sure that you're in the right one. If you're going on the right-hand side here, you're not actually signing up for a Part D plan directly. You're just signing up for a Medicare Advantage plan. But same thing, shop for those on a regular basis, but be mindful of your prescription drug coverage there as well to make sure that you are in the right one for you. Okay. Some of the things that you are then going to pay for out of pocket in retirement under the Medicare system is number one, premiums. And then there's also your private insurance premiums, whether it's a prescription drug plan, a Medicare Gap plan, or a Medicare Advantage. Other out-of-pocket costs you might pay are deductibles, copays, and all of that kind of stuff there, which we're all familiar with along the way. Premium-wise, Medicare Part A, I already said is free. Medicare Part B, which regardless of which road you're going down, the one on the left-hand side, original Medicare, or the one on the right-hand side, which is Medicare Advantage, both of those roads you have to pay for Part B, which in 2022 is $170.10 per month. And that is per person. That doesn't cover a married couple. So you would pay $170 plus for each person into the Medicare system to have Part B. There are income related adjustments to that if you have a high level of income, and we'll look at that, that slide next. Part D, prescription drug coverage, that is paid, a premium paid to the private insurer. By the way, Part B, once you're on Social Security, they're going to take that $170 and withhold it right out of your Social Security payment. If you're not on Social Security, then you will get billed. Part D, you're paying that premium to a private insurer. I think I mentioned already that a lot of Part D prescription drug plans are $40 a month. So that would be the premium there as well. I'm not going to spend a lot of time on this, but if you're married filing a joint tax return, and if your income is getting to be pretty large in retirement, then your Medicare premium costs are going to go up. Let's say you have $200,000 of income in retirement, you fall into this category. This is the total of any income that you have, including pensions, Social Security. If you own investment property, it can include rental income. Any number of things fall into this category. It also includes distributions from your 401k plans, your 403b plans, 457 plans, all fall into this income category. And if that's a total of, let's say, $200,000, then not only are you paying $170 for Part B per person, but they're going to add on another $68 because of your income level. And that not only applies to Part B, but also your Part D. If that's $40, that's going to go up $12. So now instead of paying $210.10, which would be what you'd be paying up here, you are now paying $290.50 because of your income level. Now, a lot of people might say, well, this doesn't apply to me. Well, many of you know at age 72, you are required to take out money from your, we call them qualified retirement accounts, your 457s, 403bs, 401ks, traditional IRAs. The IRS mandates that you take out so much money, and that's on an increasing level throughout retirement. And that gets added into this number as well. And as those distributions escalate, whether you want them or not, that could push you into some of these levels where your premiums then go up. And you look at some of these numbers, how they go up over time, they're pretty significant. Be mindful of this throughout retirement. There are things that you can do today to prepare for this. That's outside of the scope of our conversation today, but be aware of these income levels and how that could make up or add to your Medicare premiums. Okay, Deductibles for Part A, again, that's your hospitalization. So you have to pay the first $1,556 for a spell of illness in the hospital, which $1,500, you can go through that pretty fast, and then Medicare kicks in. Part B, those are your regular hospital visits and so on. You have a deductible of $233 per year. And you do have a deductible on your Part D plan. So the first $480 are out of pocket. And then after that, there's additional coverage there. Coinsurance, you can see the numbers there. We're not going to get for the sake of time, we're not going to get too far into this. But you do see those numbers there as coinsurance amounts. But again, these are areas then that your supplemental policies might be picking up. Your Medicare Advantage policies might be picking these up, but that's specific to the policies that you choose from those individual private insurance companies. Part D, we already talked about the $480 deductible. There's levels within here. Essentially what you would want to do again is have a list of the prescription drugs that you are perhaps taking, and then dictate the policy in order to make it specific to you. What Medicare covers, once the coverage does kick in, 100% of hospitalization, medical services, a lot of regular doctor visits, outpatient services, and so on. There are Medicare approved amounts, and then there are non-Medicare approved amounts. And many of you know that with your doctor, or if you're going to have a procedure, is to ask them, is this Medicare eligible or not? If it's not, then you need to be looking at your supplemental policy or your Medicare Advantage policy. There's other preventative services like flu shots and other screenings that can also be covered. For a complete list of covered services, this is where I'm going to mention this. This is the publication called Medicare and You. This is the one specific to 2022. All of you should have this, especially if you're getting to that point of going on Medicare. This talks completely about what's covered, what's not covered. This is a well-done publication that all of you should have. You can call the phone number there. You can call medicare.gov, download the PDF, and have this. It's easy to read. It's really pretty well laid out. Have Medicare and You available to you as a resource. What Medicare doesn't cover, a lot of people don't know this. It's not going to help you with long-term care costs. Also in retirement, if you're planning on traveling outside of the United States, don't even bother taking your Medicare card, because there's not a doctor outside the United States that's going to accept that. And so what I tell people is, if you're going to travel outside of the country, get a temporary health insurance policy just in case something goes wrong when you're out of the country, but that's going to cover you where Medicare won't. Medicare itself does not cover dental. It doesn't cover vision, although Medicare Advantage policies now are commonly covering or have some coverage of both dental and vision. Doesn't cover hearing aids, doesn't cover cosmetic surgery, acupuncture, or amounts over the Medicare approved amounts. And then also things that are not covered through deductibles and coinsurance that you might have to pay for out of pocket. For the sake of time, we're going to move past that. Medigap policies, or more commonly known as supplemental insurance policies, again, bought through a private health insurance. They're sold by those companies. They are meant to fill the gaps of Part A and Part B. And there's a lot of laws that regulate these policies. So if you're working with a private insurance company on a Medicare supplement policy, you can have a relatively high degree of confidence that this is being approved of and regulated by the Medicare industry, or the Medicare department, I should say, as a way to protect you. And again, these policies for Medigap or supplemental policies, they are standardized. They are specific to states. Wisconsin has some, we're not going to get into that. They have some other things that the state of Wisconsin requires. But Medigap, which again is a supplemental policy, it does not work with Medicare Advantage. you have one or the other. You're on the left-hand side of the chart with original Medicare. That's where you would get a supplemental policy, or if you're on the right-hand side, that's where you would be on Medicare Advantage. You would never have a supplemental policy and a Medicare Advantage policy together. Those are two separate things. It's one or the other. You do pay a monthly premium, and the costs vary by plan. So let's fill out this premium a bit more. So if you're on the left-hand side, if you're taking that road, Part A, again, is free. Part B this year is $170.10. If you get a Part D, that's a prescription drug benefit, commonly $40, so you're up to $210. A lot of supplemental policies that I see these days are in the $130 to $150 a month range. So we'll basically take that from $210, add the supplemental policy, you're close to about $350 a month in premium per person. Okay, so for a married couple, if you're going down that road, that'd be $700 a month then household. And so that, again, it's expensive, but that's some of the best health insurance coverage that you've ever had. Now, on the other side, the Medicare Advantage side, still have Part A that's free. Part B is $170. But the only other premium you pay is for Medicare Advantage then, and that's averaging about $27 a month. Had a couple visiting with me today, he was at $26 a month. So very slim range right now of what those Medicare Advantage premiums cost. So if you're paying $170 for Part B, add in, let's say, the $27 for Medicare Advantage, you're getting a pretty complete version of Medicare for about $200 a month, which is certainly cheaper than the $350 a month, but you're going to get nickel and dimed along the way. That's where you might spend another $500 to $700 out of pocket. Now, I've got some clients that never go to the doctor and they're healthy. So there's some years where they're just paying $200 a month and then that's all that they pay. But it really depends in this decision on original Medicare versus Medicare Advantage is, do you go to the doctor a lot? If you go to the doctor a lot, then the left side is probably better for you, even though the premiums are more expensive. Medicare Advantage works pretty well for people who don't go to the doctor a decent amount. What I tell clients, though, is before you terminate employment, get all your checkups done, get all your regular stuff done, even if you haven't done that in a while, before you enroll in Medicare Advantage and see kind of what shakes out with that. I have actually seen some Medicare Advantage policies that are free. You enroll in Medicare Advantage. Again, you're going to get nickel and dimed a little bit more, but they are free. And you might say, well, how is that possible? How are those insurance companies making money? Well, they're getting subsidized by Medicare. So even though you might not be paying premium or much premium, they're taking money from the Medicare supplement and the subsidy, and then they're putting these policies together and making them work. By the way, the regulation on these insurance companies are to the point where these companies can only be so profitable off of these policies. They can only make so much money off of these policies that it is capped then, and Medicare regulates all the finances then off of these policies as well. Costs vary by plan, whether it's supplemental or whether it's Medicare Advantage. Shop the things that are good for you. Now, one other thing about Medicare Advantage is this works well for people, but you really have to stay in network. So if you're used to working within a group of doctors through Freighter and others, I mentioned that one because that's probably a lot of you, but Medicare Advantage is not a plan set up if you are seeing different doctors that are all a part of different networks. That does not work very well. Then you should stay on the left-hand side, which is original Medicare. But if you can stay in network, which a lot of us do anyway, then Medicare Advantage works pretty well. Now, I get asked all the time, well, can you switch back and forth between Medicare Advantage and original Medicare? I'll say no to that question, but you can start out on Medicare Advantage and switch over to original Medicare. That is allowed. And especially if you do that within the first 12 months, you start on Medicare Advantage and you decide that's not for you, you want to go on original Medicare, you can do that within 12 months and not lose coverage. You can't be denied for pre-existing conditions and so on. After 12 months, now you run the risk of delays in coverage, gaps in coverage. Switching from Medicare Advantage to original Medicare and going back and forth is not a strategy. You might move once, but then that's it because of, you know, some of the gaps in coverage there. And that's something that you will have to kind of sift through as you consider that. Okay, shop carefully for private insurance. We've talked quite a bit about that. So we're going to take questions in a moment, but just a couple of quick reminders for final words on Medicare. We've covered a lot of this, so I'm going to skip ahead to here. Reminder number one, have I made it clear that it's important to enroll in Medicare on time? If I haven't made that clear, then I've done a very poor job in this presentation. Sign up for Medicare on time, and hopefully we equipped you with the information on how that applies to you. Reminder number two, always shop carefully for private insurance, whether that's Part D, Medicare Advantage, or the supplemental policy. Shop carefully for what's best for you, and then continue to shop it on an annual basis because things change. You change, coverages change. Shop it on an annual basis. Number three, plan for higher healthcare costs in retirement. Healthcare, long-term care, which we didn't get into, those are the biggest threats to people in retirement as they go into it. And certainly those things can be very difficult for your retirement to manage. So I'm going to put my contact information up here. If you have any other questions, you can feel free to give me a call. You can shoot me an email. I am currently right now in my office in Waukesha. And so I actually invite you to come in and see me if you'd like. I'll give you kind of an individual review of Medicare. A lot of people ask me, well, do you sell Medicare policies? The answer is no, I don't. I'm licensed to do so, but I would rather see somebody who specializes in those policies every day help you, and I can get you in front of those folks as well. But any other issues regarding retirement, Social Security, Roth issues, tax issues, I work with a lot of my clients on that. So feel free to reach out to me. I'd be happy to have a discussion with you. It's no obligation. It's complimentary because you're a medical college employee. So I will stop there and we will cover questions and then get you outside to this beautiful evening that we have.
Thanks so much, Mark. Quickly, I just want to mention to this group, we receive a request if you continue to work past age 65, so you aren't going into that original Medicare enrollment period, you're going to enroll in a special enrollment period. We receive a form frequently and fill them out for employees all the time that provides a proof of your credible coverage that basically is saying that you were still covered at MCW, and that's why you are enrolling in a special enrollment period. And we fill out that form on a regular basis. So it's a form they would provide to you. So I wanted to mention that so that you're familiar with that. It happens and that we fill them out all the time. So if you get something like that, call the benefits office. We're happy to help you through that and can complete that form for you to show you had coverage at MCW. We have a couple of questions. One relates to the enrollment period, that what if you are laid off and over 65? Is that falling into the special enrollment period, or how is that handled with the layoff? And being over
so
65?
That's the reason that there's an 8-month period of time after the termination date of your employment. So if you're laid off, they realize that getting laid off is not exactly something that you can plan for. And so that's where they give you the 8-month period of time. But remember, if you're signing up for Part D, that's only 63 days. So I will suggest to you that if you're laid off, you've got time, but not that much time. And then I would get going on your Medicare setup as quickly as possible. But it can certainly be done without any penalties or losses in coverage.
And then does Medigap have any dental and vision coverage?
Generally not, and it appears that the Medicare Advantage policies are better for the dental and vision. Now, I think that what's happening is the Medigap or supplemental policies might be losing business to Medicare Advantage. So I think that's creeping into the supplemental policies a bit more. Part of it is, I think people make a bit too much about dental coverage in retirement. Because if you're primarily going in for just regular cleanings and you don't have a lot of procedures, I don't know that you need that much coverage anyway. But then obviously, as you get older, there might be some other major things that can happen. So yes, I think there are some policies, although the Medicare Advantage policies are appearing to be covering those two things better. And that's probably where you want to start. But shop online for coverages if you really want a supplemental policy that cover those, because it's not unheard of. All I'm saying is that Medicare Advantage seems to be a little bit more geared that way.
Okay, and as I mentioned to the group earlier, we will send the slide deck to you post event here, and also a brief survey. So we will be sending the slide deck to all the participants today. An additional question: if I retire at 65 and sign up for Medicare, what options exist for my spouse who is 1 year younger?
So, and that is, so number one, there might be COBRA coverage available perhaps, but that's specific to your plan. But number two, that might be something where you're going to have to get an individual private insurance policy, which can be expensive. But if you don't have a lot of health conditions for that person that's not 65 yet, then go with a high deductible policy and you're probably going to be fine. Although still premiums are going to be a decent amount. But there would not be Medicare coverage because that person is not 65 yet, even though they're married to somebody who's 65. So it's either trying to continue coverage through the employer, perhaps through COBRA, or just frankly, you're going to have to find it through an individual insurance policy. But you only have to bridge 1 year there and then obviously go on, or however young that person might be, and then go on Medicare.
And let's say you are working July 1st and retiring July 2nd. How do you find out if you have MCW insurance for the whole or part of the month of July? Then you would need coverage August 1st or earlier. So what I will just share with the group here is that if you actually work on July 1st and retire July 2nd, the coverage goes through the end of that month. So you would have coverage through July 31st, for example. I think that answers that. A whole or part of the month. Would you need coverage August 1st or earlier? So you really shouldn't need coverage until August 1st in that case.
Yeah. And that's true of almost all employers, where if you're insured on the first of the month, you're insured for the month.
Can my husband and I choose different options? For example, original Medicare for me and Medicare Advantage for my husband?
Absolutely. So, and that's the way a lot of couples do it. As I plan with my clients, I'll ask them, how often are you going to the doctor? What type of health conditions that you have? And it becomes clear that maybe one person that might have a number of health conditions already existing and going to the doctor quite a bit, they should probably go on original Medicare, while the other person might be in an entirely different situation and then they go on Medicare Advantage. That's not a problem at all.
Great. Next question, if I sign up for Part A at or just before 65, but continue to work, does MCW's insurance become secondary?
I want to say that, Terry, do you know, is there any sort of, there are employers where then that you need to go on Part B, but then your employer coverage becomes secondary or almost like a supplemental policy. I think that might be the case there. Is that correct?
I'm going to have Leanne jump in because she handles this question all the time. So go, my understanding, but Leanne, correct me if I'm wrong. MCW is still primary if they're continuing to work.
Yes, because we employ more than 20 employees. That's why.
So MCW would be primary, but if you sign up for Part B, then that becomes a supplemental policy.
Correct. If you're actively working and still covered under MCW's health plan, but you did elect to do Part B, MCW's is still primary as long as you're actively working. Yes.
Correct. Yep.
But there is not a requirement that you go on Part B.
No.
No.
No, we don't.
No, that's still optional because
it.
you're actively working. Like Leanne said, the key there is you're continuing to be actively working.
Correct.
Yep.
Okay. I'm just double checking. I think we've gotten all the questions, very good questions by everyone. One last question. Did you say that you cannot switch from Medicare Advantage back to Medicare?
No, I did not say that. I said that you can definitely switch from Medicare Advantage to original Medicare. And there's two howevers. If you switch from Medicare Advantage within the first 12 months of coverage, you can go from Medicare Advantage to original Medicare, and you are not penalized due to because of loss of coverage or gaps in coverage. The problem is if you're on Medicare Advantage and more than 12 months goes by and you want to move from Medicare Advantage to original Medicare, there might be some things that you've developed as pre-existing conditions which may not have guaranteed coverage or full coverage on them, and that's where you have to be careful. So Medicare Advantage, I tell people, needs to be your long-term strategy. If you're uncomfortable with that, then go on original Medicare. Although, maybe try it for the first 12 months as you go on Medicare, and then you've got full freedom there. But be careful because 12 months goes by pretty fast. And then you really need to ask yourself if Medicare Advantage is going to work well for you, or should you really be on original Medicare? But what I did say though, is don't have a strategy where you're going back and forth from year to year. That's going to be a disaster.
Okay, I think we've answered everyone's questions today. So thank you, Mark. Lots of information and lots to digest there. We will share the slide deck. Mark has offered to answer additional questions if you have them. So don't hesitate to take advantage of that. And I appreciate your time this afternoon. And our next session is next week, Wednesday at noon. And that is top tax savings. So we look forward to you joining us then. And thanks for your time this evening and have a wonderful evening.
Thanks, everybody. Appreciate the opportunity.